New parents are very familiar with this. You go to that wellness visit with your baby and they check for hip dysplasia. And sometimes that means you have to have a soft brace at the hips for the babies. But did you know sometimes those symptoms start in the teen years, and that can be really painful and damaging the hip joint. Sofia Younkerman was 15 when she had her first surgery. Dr. Erica Valentine from Children's Hospital, Colorado, treated her over the years, and they join us now. Sofia, tell us briefly, you were an athlete.
Yeah.
And that's how you discovered this pain? What happened?
Yeah, so summer of going into my sophomore year, I was doing 3 hours of POMS practice and 3 hours of track practice, 5 days a week for a whole month. And I was in physical therapy already. And I brought it up to her. I was like, I'm having like hip pain, like my hip's been giving out on me. She's like, you should go see an orthopedic surgeon, just get an x-ray, just make sure it's nothing serious. Turns out when I got the x-ray, they're like, this is really far, like this is really bad hip dysplasia. Like it was very clear, you could see it on the x-ray. And so I started treatment with the hip team at Children's Hospital. We tried intervention pain stuff, like inner hip joint injections and stuff. And so I finally decided with all the pain, we were like, let's just get the surgery done. So in March of 2024, I got a PAO surgery.
Okay, Dr. Valentine, explain this a little bit. First of all, it's more common in babies, is it not, to diagnose this? And when you say severe hip dysplasia, you don't have a lot of options.
Correct, yeah. So hip dysplasia in newborns is the most common orthopedic disorder that we see in children. It happens in about 1 in 100 newborns. In Sofia's case, she had adolescent hip dysplasia, which really can happen from one of 2 pathways. So either a child can have newborn hip dysplasia that is treated to the best of our abilities, and yet they still have something called residual acetabular dysplasia, or in Sofia's case, her dysplasia was most likely, we call it developmental hip dysplasia because it really develops over the course of years.
Wow. I know you did the surgery, and then a lot of things happened when you're at Children's Hospital, Colorado. You got to meet Miss America when she was visiting.
Yeah.
That led you down the route to actually enter pageants, and we have some photos with that Miss Teen Colorado and other things. I mean, this recovery is long. It's a long recovery. It's a serious surgery. I mean, it takes a while, but it sounds like, I mean, if you don't do it, you're going to have a lifetime of pain.
Yeah, so hip dysplasia, really, it's the socket of the hip doesn't develop quite as deeply as we would like it to. And what happens is it leads to inflammation, pain, early arthritis, and then possibly the need for an early total hip replacement. And so treating adolescents like Sofia, we're really trying to avoid all of that.
Yeah. Well, I know that wasn't an ideal time in your life, Sofia, because you said the recovery was months and months of no weight bearing and everything. But how has this changed you? What's this done for you? It sounds like it's led to some good things.
It's definitely made me more resilient. I've had to face a lot of hardships that normal 15-year-olds don't face. I had a bleeding episode during my surgery, so had to get lots of blood tests to figure out that. We haven't figured it out. And so I've been like a chronic patient in the hospital, and so I've had to manage my way through navigating my high school years as someone who lives in chronic pain with a chronic illness.
Yeah. You're at Highlands Ranch High School? Or
I go to Colorado Early Colleges now.
That's it. That's right. Okay. Well, I wish we had more time, but I know you formed a tight relationship. Your mom said that she saved your life a couple of times, Dr. Valentine, so that's wonderful. Thanks for bringing attention to this. I think it's something we don't often think about in young adolescents, so hopefully people will pay attention. If you got that severe pain, get it checked out. So thank you both. And
Thank you so
continued
much.
healing, right?
Yeah.
We'll see a lot more of you. Thank you.
Thank you.
Thank you.